Beyond BMI, Redefining Obesity Assessment for Better Health Outcomes. In this episode, we explore the limitations of BMI as a sole indicator of obesity and discuss the Commission's recommendations for incorporating additional measures such as waist circumference and body fat distribution. We delve into the proposed diagnostic categories of clinical and preclinical obesity and their implications for personalized treatment and public health policies. Obesity has long been assessed using body mass index, BMI, a simple calculation based on weight and height. However, recent insights from an international commission of experts highlight the limitations of BMI in accurately reflecting an individual's health status. The Commission advocates for incorporating additional measures such as waist circumference and body fat distribution to provide a more nuanced understanding of obesity and its associated health risks. Limitations of BMI. BMI fails to distinguish between muscle and fat mass, potentially misclassifying muscular individuals as overweight or obese. Moreover, it does not account for fat distribution, particularly visceral fat, which is closely linked to metabolic diseases like diabetes and heart disease. Dr. Robert Kushner, an endocrinologist and member of the Commission, emphasizes that belly fat contributes to systemic inflammation, increasing the risk for these conditions. Proposed diagnostic categories. The Commission suggests redefining obesity into two categories. Clinical obesity, characterized by excess body fat accompanied by health complications such as hypertension, type 2 diabetes, or cardiovascular diseases. Preclinical obesity indicates elevated body fat levels without current health issues, but with a higher risk for future metabolic diseases. This classification aims to facilitate personalized treatment strategies and early interventions. Alternative assessment tools. To enhance obesity diagnosis, the Commission recommends incorporating waist circumference, measures abdominal fat with thresholds indicating increased health risks. Waist to hip ratio assesses fat distribution by comparing waist and hip measurements, providing insights into cardiovascular risk. Waist to height ratio evaluates central obesity by dividing waist circumference by height, with a ratio above 0.5 suggesting increased health risks. These measures offer a more accurate assessment of health risks associated with fat distribution. Implications for treatment and policy. Adopting these comprehensive assessment tools could lead to improved access to care. More individuals at risk may receive appropriate interventions. Personalized treatment, tailored strategies based on individual health profiles, policy revisions, updated guidelines reflecting a multifaceted approach to obesity diagnosis. This paradigm shift emphasizes the complexity of obesity and the need for individualized care. Conclusion. Moving beyond BMI to include measures like waist circumference and body fat distribution offers a more accurate and personalized approach to diagnosing and managing obesity. This comprehensive framework aims to improve health outcomes and address the global obesity epidemic more effectively. Disclaimer: this podcast is for informational purposes only and does not substitute professional medical advice. Individuals concerned about their weight or health should consult with a healthcare provider for personalized guidance.